is someone who we are very familiar with in our leadership world as well, and is a wonderful supporter of the Ashtabula County community in a variety of ways, from the business and professional standpoint, as well as engaging in a lot of endeavors that really support and grow our community. And today's speaker is Michael Hrabowski, who is the President and CEO of Ashtabula County Medical Center.
Thank you, Laura, and thank you, everybody. I really appreciate your attendance today. Usually I walk around a lot, so it's going to be a little hard for me to hold on here today, but we ask that you bear with me. And again, thank you for being here. So this is where it all started. The great train wreck in Ashtabula, right behind the hospital, December 29th, 1876. You can see the locomotive over there. In doing a little reading and a little history research, 157 people were on that train. There were 2 engines. Miraculously, the first engine made it over the bridge before it collapsed. The next car to go down was filled with people. It was the first passenger car. And the engine that you see on the side is on top of the passenger car. I couldn't read in the book how many people actually died. This is a little morbid, but it stirs a lot of emotion in me. 19 caskets were filled with parts, body parts, and 6 days later, more caskets arrived. This is where we started. The community rallied right after this, did an emergency hospital, and in 1904, ACMC, the doors were opened to Ashtabula General Hospital in June of 1904. We celebrated our 110th anniversary. Our goal is we're now preparing for the next 110 years. Ashtabula County Medical Center. We're a full-service hospital. We're managed by Cleveland Clinic, not owned. I'm going to talk about that. Local board of directors, and we are focused on the economic growth. Keep that slide up, please. I forgot to mention, I just want to accomplish 2 things today. Hopefully when you leave, you'll know a little bit more about ACMC, who we are, what we are. My second goal is that there'll be a greater understanding of how the community could really partner with ACMC to drive economic growth and development. And I have one ask, one favor. If you like what you heard, if you believe what you heard, please tell your friends, neighbors, and colleagues. So again, I'm going to go through this. I want to focus on ACMC being, if you could flip back, the community hospital. There's a lot of confusion out there. ACMC is owned by the community. This is your hospital. You're my bosses. We are not owned by Cleveland Clinic, but a great partnership. We are managed. I'm a Cleveland Clinic employee. Ken's here, Frame, our chief nursing officer, is part of ACMC's admin team. And Lou Hutchinson's here. We have a handful of Cleveland Clinic employees that help manage the hospital, but it's a local board of directors. There's 18 people, only 3 of them are Cleveland Clinic. Sue Stocker, I don't know if she's here today. Sue's our incoming board chair in March. So it's really a local board who knows what's going on in this hospital and in this community. And later on, we're going to talk about the economic growth piece. That's our logo. We do show our partnership with Cleveland Clinic. How great to have local control, local ownership, drive decisions locally, but be partnered with one of the best, if not the best, hospital in the world, and to be able to draw on those resources when we need them. A little bit about the hospital. We're more than a hospital. We're a little mini health system. Here's all the components. Ashtabula County Medical Center, the main hospital, we're about 750 employees. Glenbeigh and Rock Creek on 82 acres. We don't hear a lot about it, but 280 employees there. The Ashtabula Clinic is the name of our physicians and the employees that support our employed physicians. 170 home health, 100 employees in our home health agency. And again, these are all owned up through the ACMC Healthcare corporate system. We have our foundation, and Tammy Nekowitz, our head of our foundation, is here today. And Community Care Ambulance, 50% partnership, and this is really a good partnership with university hospitals. ACMC 50%, and UH 50%, 250 employees. Their services stretch from Ashtabula down to Akron, and I hear we're even talking to Columbus now. And it's an unbelievable organization based right here in our own county. So pulling out the ambulance community care, we have about 1,300 employees in our health system. Just a little bit of fact and figures. 1,300 employees every year, $86 million in salaries and wages, we'll talk about a little bit later. $24 million we're on pace for in 1 year for 2015 in charity care and bad debt. That is when people cannot pay for their care, what the hospital contributes. The contribution to the city of Ashtabula, it costs us every month $12 million to run the hospital. And we collect about 31 cents for every dollar in charges to run the entire hospital. A little chart on FTE growth that we're going to talk about, full-time equivalent employees. If we could flip it. Over the last 3 years, while many health systems have been struggling, have been shedding people, have been reducing their staffs, thanks to the support of the community, ACMC is in a growth mode. We are on track by the end of 2015, we just finished our budget, that we will in the last 3 years have added 160 full-time jobs, full-time equivalent jobs to our payroll. Little shot of our payroll. You don't realize this when you're doing it, but when you put it on paper and trend it, it's pretty amazing. This is the growth in our payroll. We're on target to hit about 86 million, 86.5 million. I'm going to talk about what it means to be a full-service hospital. Next slide, please. This is a busy slide. Full service just means we have a lot of services here at ACMC. We have emergency care. 35,000 patients each year visit our ED. Surgery, it's not just general surgery, orthopedic, urological, vascular, podiatry, kind of broad array, cardiology, cath lab, all kind of cardiology services, cancer care, maternity. We have inpatient, outpatient, behavioral health, skilled nursing, and just the list goes on and on, lab, pain management. The community should know that you can get 90% of your needs can be met right here in Ashtabula County. So if you could flip back, we have a very special model that we think is different than any other in the county. And that is, our goal is everything is full-time. When we recruit physicians, we recruit with the intent that you're going to be a full-time physician working only at ACMC. We do have other physicians I'm going to show you that float in, but our model is you come here to work in this county. Full-time, that means full-time care. It means when you're in a hospital bed at ACMC and you need a gastroenterologist, you need a neurologist, you need a cardiologist, somebody's there every day. You're going to see somebody every day for your full-service care. And our model is we want to keep care in Ashtabula County. So we have a lot of physicians. Busy slide, I'll go through it real quick. It's just to show, again, the scope of specialties full-time that are here in this county at your hospital every day. Could you flip back, John? Internal medicine, pulmonology, pediatrics, psych, vascular, pain management, it's all. And I'm going to throw out some names that you may recognize. Who's a better gastroenterologist than Dr. Ashok Khandru? I mean, unbelievable. So it's not just the number of physicians, it's the quality of physicians. Dr. Delgosh, Dr. Weiss. We have some new folks too. Oh, that reminds me, when I came here, I've been here 3 years, there was a nasty rumor going around saying it's hard to get physicians to come to Ashtabula County. Incorrect. It's easy. It's easy. We've recruited from all over the country. And this isn't me up here bragging ACMC so great. This is, they come here because what they saw in the people and in the community. Every physician that has come from outside to here, I ask them, what do you like about this place? They don't say, hey, it's you, Mr. Administrator, you're really good. They say, we like the community, we feel appreciated at this community, and our patients are like no other that we have ever encountered. So it's this community. So flip back, please. Others that we've recruited from Greece. Janet's here. Janet's our recruiter, Janet Vettel, and everybody knows Janet. Don't ask me how, but I'm getting emails from a physician in Greece at 3 in the morning. And Dr. Bibidakis, born in Greece, trained at Temple University, went back to Greece. Next thing I know, him, his wife, and his 5 kids are moving back to the United States, working at ACMC. Dr. Papsadero, ENT, head of the largest group in Northeast Ohio of ear, nose, and throat physicians at one point in time, full-time at ACMC. We've just had tremendous success thanks to the open arms of the community. We do have Cleveland Clinic specialists too with our partner, cardiology full-time, cancer full-time, orthopedics, radiology, and then we do have some part-time clinics. So there is a little bit of part-time physicians going on, but 95% of our activity is around full-time physicians. It's not enough just to be up on Lake Avenue here in Ashtabula. We realized when we came here, we have to have a presence. We have to take our health care out to our communities. This is work in progress. We are by no means finished. Jefferson Family Health Center has just tripled in size. We have a health center out in North Kingsville with Dr. Chilcott, one of the biggest practices anywhere. Conneaut Family Health Center opened earlier this year and was well received. And Harbor Family Health Center with Dr. Lambros just joined us, and that is available to our community also. That's a little shot. That's about 1/4 of the building, but we did recently expand and triple the size. It was a $1.5 million investment. Why did we do this? We did it to improve access. We now have 5 physicians that are down there. We put X-ray down there. There is express care, which is walk-in care, urgent type care is available, radiology. And we felt our communities are important, and we're going to continue to expand into our surrounding communities. That's a shot of the inside. You know what I thought about when I was looking at this morning? It's nice, it's modern, but the thought that hit me is this community deserves these types of facilities. They deserve not just the best physicians, but the best facilities that we can provide. This is an artist rendering. Conneaut we opened up in the Save-A-Lot Plaza on Route 20. Again, physician offices, walk-in care, express care, urgent care type services, x-ray, lab, mammography. We're bringing the services to the community. That's one of our ads, and that just again shows that we now have 2 locations open. Our express care is a little different in that it is under the, at a lot of our sites, there is a physician right there on site. And also, our express cares are under the medical direction of somebody well-known, the head of our emergency department, Dr. Haniff, and he oversees our express care. So we're going to get away from a little bit, and I apologize, that was a little bit of an ACMC commercial. Thanks for listening, but now I'd like to get into issues of quality, patient safety, and then really get to the heart of business issues towards the end. Flip back, please. There's not a title on here, but ACMC was recently notified by a national entity that we received what's called an A rating for hospital safety. And this group is called the Leapfrog Group. I don't know if you've ever heard of them. They are a nationwide group. They came together as a business coalition for 2 purposes: increase quality of health care and decrease cost. We don't get asked to participate in this little survey. They come in and pull Medicare data from the government's data banks, and they look at safety data, infection rates, volume of services, what type of services, and they give hospitals across the country a grade. We're really proud, and I'm proud of our 1,300 caregivers who earned this, that we received that A score, meaning ACMC you can trust to be a safe hospital and a high-quality care hospital. You will not, and I know this sounds a little bit competitive, but we are the only A-rated hospital in this county. You won't find an A-rated hospital in Lake County. Just November, last month, we were notified by Joint Commission. I don't know if everybody knows who Joint Commission is. A nationwide inspection body. They send teams to your hospital, every 3 years, and they go through from looking up into the ceilings to what kind of care is being delivered at patient bedside. It is a thorough review. They also pull quality data, and we were notified last month that we ranked, there's 5,000 hospitals in the country, that we were in the top 20% for heart attack, surgical care, and pneumonia. Hold that slide. Again, I am not here to say ACMC, it's all about, to me what gets me excited about this is I want to get the message out that you can get great care in our own Ashtabula County. You don't have to have the mindset that it must not be good if it's Ashtabula County, that you got to leave the county for whatever. So I'm just really proud of our 1,300 caregivers who worked hard to earn this. Plain Dealer, if you read the Plain Dealer partners with a company to survey if employees are happy. Why is it really important that employees and caregivers are happy? Not just to make administration happy, but it's been correlated that satisfied employees deliver better patient and safer patient care. So to us, there's nothing more important than making sure our employees are getting the tools they need to do their job, that it's a good and comfortable work environment, that there's responsive management. Not that we're always going to agree, but we are always going to try to make sure our caregivers are supported at 1,000%. So we said, yes, we'll participate. Then we're done as far as administration. All they ask for this company is says, give us your email list of all your employees. And they send the survey out. We don't get to see it. They send it out. Employees can go online. It comes in their email. They send it back in. And this is throughout Northeast Ohio. And ACMC, again, was recognized for our 4th year in a row in large employers in Northeast Ohio. And that's why I'm proud. I love hearing ACMC large employer, but I really like hearing this is Northeast Ohio. And we did really well. We did number 12. We outranked some companies that were recognized in the top 25. A couple names you might know, Goodyear Tire and Rubber, Parker Hannafin was one. We may have some of the banks in the room, so I got to watch. There were several large banks in there, and there were several health systems in there, and I don't want to mention all of them, but we ranked highest of any healthcare system in that rating. So this is a little map that John, right here, who's with me, put together. It's called an employee dispersion map. So this is kind of Ashtabula County in the middle. Each dot represents an employee, but it's work in process. We don't have our 200-some Glenbeigh employees. If we did, I would suspect the middle of the county and south would be a little heavier dotted. So I'm going to say something that sounds horrible. This is my transition slide into the economic. While the map says employee, and this is going to sound terrible, I view each one of those dots as an economic contributor to Ashtabula's economy, because each of those dots make up that $86 million in payroll collectively. So some of you have may seen this crazy ad. I got to take a poll, because we pay a lot of money for advertising. Has anybody seen this before other than on their little placemat? Anybody seen this? Oh, okay. This helps me gauge return on investment in marketing dollars. So we started this crazy advertisement about 8 months ago called 56 Million Reasons to Seek Healthcare. And we see $100 bills in the middle going out to Erie, Cuyahoga, Lake County, Geauga, Trumbull County. And the message we're trying to get out again is there should be no reason that our economy gets shipped out of this county. So where did this all start? Why this ad? Where did it start? It started 3 years ago, if you can flip. When I got here, our administrative team started looking at what's going on in Ashtabula County with healthcare. This is a real busy slide, and I apologize. Some quick facts. There's 100,000 people in our community, right? Ashtabula County population about 100,000. Every year, every single year, 16,000 of those 100,000 end up admitted to a hospital. 16,000. Here's the sad story. Only 8,000 of them are admitted to hospitals, whether it's UH, ACMC, are admitted to hospitals in Ashtabula County. We're only capturing 50% of our own residents are trusting us for their care. Now you may say, wait a minute, you don't do brain surgery, nobody does neurosurgery, nobody does heart surgery. That's true, but we dug down deeper into the numbers. I won't bore you with all the graphs. Small amount of admissions are for those types of high-end services. We found stuff going out like ENT, ear, nose, and throat surgeries they're going out of the county. Basic pulmonary, really basic services leaving this county. So where are those people going? That's the second block. Flip back, the green block. I'll use the 80-20 rule. 20% going to Cleveland Clinic facilities, main campus in Hillcrest. 80%, 80%, 6,364 Ashtabula County residents left to have their care done at UH Case's main campus, Geauga, Lake Health, and out in the eastern part, Pennsylvania hospitals. So 20% Cleveland Clinic hospitals, 80% of those 8,000 other entities. So we looked at what does that mean for the economy? Now, I'm going to tell you, the numbers you are going to see are not a big scientific study that we paid a consultant. It's me sitting with a napkin and a pen, having coffee with Ken and Lou, talking about really, what does that mean? Could that mean for our economy? So we saw that 8,000 people, inpatients, leave the county. I called up our CFO, Don Kepner. Hey, Don, how much money do we get for one admission? And it's about $7,000. That's not profit. We have to pay everything out of all that, but $7,000. So that's $56 million in inpatient leaving. From my old strategic planning days, I know that outpatient dollars are about equal. If you're leaving for inpatient, you're probably leaving for outpatient work too. So on that assumption, we added $56 million in outpatient for a total of $112 million leaving the county every year. Let me repeat that. Every single year. Next slide. So this is my dream, and you're going to think I'm crazy. I do dream about this. I really do. I said, what if we could capture, we get it. You're going to leave for brain surgery. I'm going to leave for brain surgery. We're not going to do that at ACMC or Conneaut or Geneva. What if we could recapture those 75% of those dollars? Just 75%. That would equate to keeping in our county $84 million every year. Next slide. On average, you saw our salary figure of $86 million. You saw our 1,300 employees. I did simple math. I divided it and said in fringe benefits, and this does include fringe benefits, what does the average employee get in salary and fringe benefits? It's skewed because this includes physician salaries, which are in the higher end, so it's skewed a little bit. But on average, I never knew this figure. On average in salary and fringe benefits, an ACMC employee, $62,000. So, next slide. Let's take that money that left from that 75%, bring it back home, divide it by an average salary and benefit. Again, this is on paper. If we could recapture those dollars and target them towards salaries, it theoretically would create over 1,300 new jobs in the county. Now, I don't know if the newspaper's here. I hope if they are, I don't want them running out writing, hey, ACMC is going to create 1,300 new jobs. Theoretically, though, what we can say is a lot of jobs could be created if our own citizens just say, hey, I'm going to give facilities in Ashtabula County a try. So what does that mean? That means that if that money stays in the county, we may be able to send more kids to Kent State. We may be able to, offer our own kids an education. We may be able to say, guess what? This year we're going to go on a better vacation. I'm going to be honest, I don't want to send our money to other counties. I think it should stay here. Let's flip. What would that mean? Keep this slide on, don't change it. That number does not take into account the trickle-down effect. Now, I thought maybe we'll hire a big firm and we'll do an economic study. What's the trickle-down? What's the multiplier? You know what? I'm not going to do that because I know there's a multiplier, and I know if we can create 1,300 jobs, I know that means more jobs because people are going to be at Sparkle in the southern part of the county. They're going to be doing more business at the Harbor Perk. Families are going to be eating at Bascule Bridge. These are not paid advertisements, by the way. We just picked and choose them. But that means that our money is going to come back into the county and that more jobs even are going to be created from spin-off from the jobs that ACMC could create. So thank you for listening. Here's my grand wrap-up. Here's our model. First of all, we have to provide high-quality health care. I don't expect anybody to come to ACMC just because we said, we're going to do great things, we're going to do that, we're going to do that. We have to prove ourselves every day, and our caregivers have that passion, that our goal is to be the best in the country. Not the best in Cleveland Clinic Health System, the best in Ashtabula County. We want to be the best hospital for what we do in the United States of America. That's our commitment. We want to keep our health care in our county. Keyword R. We want to keep our economy in our county, and we want to create great jobs in our county. Last slide. In closing, I want to go back to, hopefully I've met the goal that I tried to achieve today, that you know a little bit more about ACMC, your hospital, your owned hospital, that you kind of know a little bit maybe what our passion is at ACMC to try to create more jobs and give great health care. And my ask is, if you believe what you've heard, I don't care how many billboards you put up, there's no better way to communicate what we do than you telling your friends and your neighbors and your colleagues about what's going on in Ashtabula County. So back to the train wreck. Just like the community rallied back then to create a brand new hospital. By the way, the cost of that hospital was $14,500 back in 1904. But just like that community rallied back then, we're going to ask the community to rally behind health care in Ashtabula County, support our facility, and support ACMC. And we promise we will, again, I can't say the number's 1,300, but you saw the growth. I do promise that we will continue to climb the growth curve, continue to grow the economy, and do our small share that we can do, and that we will partner with businesses to continue to make just life better in Ashtabula County. That's our goal. I will take questions. Thank you. That was a lot of material, 3 years of excitement in about 20 minutes, but I'll take any questions.
Distinguish between emergency care, urgent care, and the centers that are popping up around the area.
Yes. So one of the ways to improve access is these urgent care, express care. We talked about express care. UH is doing some urgent care advertising. I'll be honest with you. First of all, the goal is to improve access with those. A lot of hospitals use those words interchangeably. Just talking about a title, urgent care, express care, you kind of got to walk into the facility and ask questions and see what they're really doing in the facility. So the short answer is they're used interchangeably. The idea behind both, though, is that you can walk in off the street and get non-emergency care. If you're having a stroke, you're not going to be going to an urgent care. You need to be in an emergency room. But for lower acuity, that's the purpose, is to provide access. But walk in and compare. See if there's a physician on site. See if you're backed by, again, we're kind of proud of our express care because we have a full service emergency department filled with full-time physicians, all the specialists. But you're seeing more and more of these pop up across the country, and it is to improve access to lower acuity care. Other questions? Yes?
Can you talk about the impact of the national healthcare system on your business model?
Yes, on our business model. Well, first of all, I'm going to say anything I say should not be interpreted as a political comment, because I am really bad at politics. I'm horrible at it. I'm independent. So I like to say I like to vote the issue, not the person. I've had a lot of people tell me, you're just one of those guys that don't know how to make up your mind. So anyway, I think Medicaid expansion is good for the community and good for the healthcare business model. And it's not just because of the money, but patients who were not able to pay for services, whom we still served, can now be covered by, these are the very low income, can now obtain Medicaid coverage, and at least there's a few dollars coming back to the hospital to support all the services that you just saw today. The Obamacare expansion, I'm still going to say good, but with a big caveat. And that caveat is, yes, it's opened insurance to more people because the government is subsidizing that monthly premium, but what worries me a little bit is people do not read the fine print. They say, oh my God, I can get health insurance for $50 or $100 a month. But sometimes they're not reading, well, you have to pay the first $3,000, $6,000, $9,000, $12,000 for some of these plans. And guess what? They can't do it. I mean, they will sign up. We're still going to treat them. I mean, we have to treat every patient that comes, but there's a high probability we're still not going to get reimbursed for some of those. I'm not trying to make it about the money, but if I put it on a scale and say good or bad, the short answer is it's good. It's good for this county.
The number you just gave, you're talking the deductibles.
The deductible, yes. The part that the patient has to pay at first out of their pocket before the health insurance kicks in. In some of these plans, it is overwhelming. Yes, in the back.
Would you talk about the emergency room care and the what changed? Because I still think people have a perception that you're going to have to go there and wait for hours to get seen.
Yes, ACMC, thank you, Roger, for that question. There was a big change in our emergency department. The old mantra was, you know, you come to ACMC, you're going to sit in the waiting room for hours and hours. You're not going to get. It's going to take a long time. Ken, how long is it now? 2 years. We actually split our ED into two sections, if you think about it. One is when you come in, if you are really in bad shape, if it's a high acuity, you're going to go right into the ED main high-risk, high-tech ED part. If you are coming in with something that isn't a super emergency, a life-threatening emergency, you're going to go through what's called fast track. And fast track is an expedited, come in, get seen right away, lower acuity, don't get tangled up in the big main ED. You get in, you get treated, and you get out. And believe it or not, 50% of those 35,000 patients are now coming through fast track. It's almost creepy to me. I walk down to our emergency department waiting room and there's nobody in there. It's like, and why? It's because we're getting people in and out really quickly. So we're going to keep growing that model. We're going to keep growing our express care model. We're going to keep growing physicians. There's a big number I failed to mention. All those physicians that you saw that see patients in the hospital, all the specialists also see patients that come in as an outpatient. In our budget for 2015, we are going to see 250,000 patients come in to see our physicians for an office visit. 250,000. It's just an amazing number to me. Any other questions? Lastly, many of you in this room know me, and many of you, not many, some have taken me up on this offer already. I asked you if you liked what you heard, go out and tell your friends, but you know what? If something's bugging you about ACMC or you had an experience that wasn't quite what it should have been, I want you to call the main number, ask for Mike Habowski, ask for the CEO, and a couple of you in this room have done that in a very kind way, but They've offered suggestions for improvements. I welcome that. I will come and meet with you. I will meet you anywhere, anytime, if you have ideas on how we can do a better job as a hospital and how we can do a better job for our community. It would be a good discussion to have. So again, thank you, everybody. I'll turn it back to Laura.
Thank you, Mike, for an excellent presentation. And we can truly say on many levels, the responsiveness and the commitment of Ashtabula County Medical Center to our community is incredible. Our program and the students sitting here among you really would not continue to grow, thrive, and expand if it weren't for the support of organizations such as ACMC. And they truly are wonderful corporate citizens as well as very, very deeply invested in our community. And I'd like to also take a moment. Some of you may have noticed the gifts in the back of the room. I would like to say everyone grab one on your way out, but that is not what they are for. They are actually our youth leadership students very generously are participating in the HALO program this year. And Leadership Ashtabula County has adopted 6 families, and the youth leadership students all have brought a gift for a member of the family. So they have provided the toys and gifts this year, and then our adult class members are going to be providing a holiday meal for each of the families as well. And then we'll deliver those right around the middle of December. So thank you all for your support and generosity in our programming, and thank you all for being here, and enjoy the holiday season.